With clinical care, it's really important for us to be able to communicate meaningfully with our patients, timely, but also not generate a scenario where they suffer from message fatigue. You want your communications, because they're so relevant to care, to get through when it makes sense, not send them when you don't need to, and then you want to create a process for the patient that makes it really, really easy for them to have that bi-directional conversation. We own and operate orthopedic clinics and have partners all across the country that provide orthopedic care in both private practice and sort of joint venture type settings. There's a lot of systems involved, and the challenges we're facing are getting all those systems to work together seamlessly, and then making something that's not making patient care more complex for the clinicians. Forever, we've had contact centers and patient access centers and things that allow patients to call in and have a conversation. The problem is, the more you grow, the more of those people you need, the more training they have to have, and all of those things add steps and time to the process. We needed a partner who was going to lock into that journey with us and develop at not only the pace we needed to, but with the right focus areas. A lot of telephony systems today are operating the same way they have forever. They're throwing an AI term onto the same workflows and calling it something different. And what we needed was energy exerted in the healthcare space. We sat down and said, here's what we can bring to this to help you learn healthcare, and can you help us along that journey? And Dialpad said, absolutely, give us that opportunity. We meet routinely. We discuss healthcare specific use cases where we have opportunities to improve, and Dialpad takes those back, puts them in their development roadmap, meets with our business partners, understands the requirements, and then brings back a solution. Modern telephony systems today don't spend a ton of time on voicemail. Clinical care questions, prescription refills, things that are highly specialized, require a clinician to speak to the patient. When we came to Dialpad and said, look, here are use cases in the clinical setting where we need development for voicemail, they hopped right on that. Our largest contact center is here in Phoenix, and it's what we consider our center of excellence. And we went live just a few weeks ago on a major milestone. We skipped speech, IVR, and went straight to conversational. That was not done overnight. That took a lot of collaboration with the development team at Dialpad, and it took a lot of work on the clinician side to understand what are the things we want to make sure patients get sort of out of that conversation with the agent quickly. If they say, I'm in pain, my knee really hurts, and I had surgery last week, we know, okay, great. The LLM has identified that as a post-operative care or a health risk. Let's recommend 911 if it's an emergency, and let's get them to a clinical care team. One of the immediate findings that were identified after our first Dialpad go live centered around surgery scheduling. We quickly identified we had an opportunity to allow doctors to cross-utilize these resources in a way that they weren't before. We were able to improve patient experience by letting them talk to a scheduler faster than they ever have. Historical telephony solutions give you very generic information about your business. This is how many calls I received, this is how many hung up, this is how many I answered in X number of seconds, and this is how many voicemails I have. That's great. But that really only benefits the people who are getting paid to answer the phone. What Dialpad's AI system, especially the CSAT side, has allowed us to do is to feed the operational side of the organization, the financial side of the organization, information about what's happening that we've never had visibility to. So we're able to sit down with operational leaders and say, hey, do you realize that 20% of calls that come in on this particular day to this particular line have questions about this, and we're not answering those effectively. We have a knowledge gap, and the CSAT assessment takes all of the quality assurance that we would have to do historically manually and allows you to offload a huge chunk of that. It's allowed us to have conversations with parts of the business about opportunities to improve that historical telephony systems would have never given us. Our goal is not to change how they communicate with patients. Our goal is to improve the patient care experience and make the clinicians more efficient. Dialpad brings an inquisitive mind when it comes to understanding how healthcare works, and we answer the questions, and they get all excited, and then they get to go develop a solution that has meaningful impact on patients' lives. Success for us and our partnership is honestly being able to look back in 1 year, 2 years, 3 years, whatever it is, and say, wow, we collectively have really become a factor in this space. That we are looked at as an organization who is keeping their finger on the pulse of healthcare, where it's going, what the issues and opportunities are, and then able to go back to a long list of clients and say, did we provide value, and have them unanimously say yes.